panel this morning is health foul. We're pleased Dr. Briana Hagen, a postdoctoral researcher at the University of Guelph, Ms. Heather Watson, Executive Director, Farm Management Canada, and Ms. Thea Green, Program Manager, Keystone Ag Producers. Briana is a postdoctoral researcher at the University of Guelph, Master's in Community Health and Epidemiology. She has a PhD in the Department of Population, her PhD research methods to better understand mental health and well-being among Canadian farmers. She examined how farmers and their farms are impacted by mental health outcomes with a focus on perceived stress and the barriers and facilitators of help-seeking farmers. Briana is passionate about collaborative research approaches and building strong partnerships. She started her postdoc fellowship to continue her investigations around farmer mental health in Canada. I'll do all the introductions and then turn it over to the three panelists. Our second speaker is Heather Watson. She is the Executive Director with Farm Management Canada. Director for Farm Management Canada, a national not-for-profit organization dedicated to increasing awareness and adoption of beneficial business management practices on Canada's farms. She is also her degree is from the University of Guelph and master's degree from the University of Warwick in the UK. And finally, Thea Green, the program manager with Keystone Ag Producers. Thea has a background in agriculture and education, which she employs to develop and deliver programming for management producers. She is passionate about providing farmers with the supports they need for success. And with that, I will turn it over to Briana.
Good morning, everybody. This is the joy of these new online formats. But I myself and Thea and Heather are thrilled to be here to talk to you guys today about things that we are quite passionate about, particularly mental health, and how we can continue to support Canada's farmers. Before we really get into the meat and potatoes of that, I'll provide a little bit of background. There we go, just move in the little panel so I can see my slides too. We all know that Canadian farmers are completely essential to maintaining the physical and the economic health of all Canadians. But what you may not know is when farmers are experiencing poor mental health, it impacts not only their mental health, but also their physical health, their farm productivity, family life, and potentially animal health and welfare. We also know that compared to the general population and other occupational groups in other nations, farmers have experienced an increased risk of suicide and poor mental health outcomes such as depression and anxiety at an increased prevalence and an increased risk compared to that general population. However, we don't know that much about the Canadian farmer mental health scene. So across the globe, governments and community groups and mental health service providers and experts have been calling to make farmer mental health a research policy priority. And that's also true here in Canada. It's traditionally been understudied, but back in May 2019, the Canadian House of Commons Standing Committee on Agriculture and Agri-Food released a report highlighting mental health as a priority for farmers. Within this report, 10 recommendations were made to improve mental health within the Canadian farming community, and 6 of those recommendations are related to mental health awareness, research, prevention, and intervention services that are targeted to farming populations. More specifically, the report details a big gap in comprehensive research regarding mental health outcomes. So like I said, in the last 15 years, there's been not very much research done. So where to begin? What we wanted to do to start, before we knew how to address some of these recommendations, we needed to know how our farmers were doing. So in order to do that, we conducted a national survey of farmer mental health in Canada. This was done in our lab at the University of Guelph under the supervision of Dr. Andrea Jones-Bitten. And what we did was we collected data looking at many mental health outcomes, including stress, anxiety, depression, burnout, and resilience, and help-seeking behaviors. We did this in early 2016, and what we really wanted was just a brief snapshot, 250, 300 farmers to take part in our survey, so we could have a baseline to know where we were at. Were farmers doing just fine? Did we not need intervention? Or was there something else going on, as we had heard anecdotally? So what we ended up having was over 1,100 farmers took our online survey, which was a huge response and kind of speaks to the call to action that farmers have been pushing for. So this was a cross-sectional survey, and I just want to reiterate that to assess these mental health outcomes that we used validated psychometric scales that have been widely used in other countries and in farming populations to look at mental health in farmers. We wanted to do that to make our results comparable to other countries. But I say this mostly because I want you to know that we weren't just asking folks, are you depressed? Yes or no. Do you experience anxiety? Yes or no. We were using these clinical tools that included the perceived stress scale, Maslach's burnout inventory, the hospital anxiety and depression scale, and the Connor-Davidson resilience scale to make sure that these were clinical tools that were screening tools that were valid. And what we ended up finding was that 45% of the farmers surveyed were classified as having high stress. And I'm going to come back to that in a second. Almost 60% of farmers met the criteria for an anxiety classification. Over a third of farmers surveyed met the criteria for depression. And 40% of the farmers surveyed across Canada said that they would feel uneasy about seeking professional help for a mental health struggle due to what other people might think. So coming back to stress for just a moment, we need to recognize that stress is something that's closely associated with poor health practices, procrastination, decreased life satisfaction, depression and anxiety, increased illness, increased risk of heart disease, and higher death rates. So we talk about stress a lot, I know, and particularly in these times in the last, 9, 10, 11, almost 12 months where we're experiencing this pandemic, people talk about stress a lot. And I just want to take a moment to remind you that stress is not always a bad thing. When we are at peak performance or peak stress level, we're really focused and motivated and it's optimal. However, once we tip over into the sick and disease chronic stress, that's where things get a little bit hairy and scary. There can be panic, anxiety, anger, fatigue, depression, and then burnout and disease. And when I'm talking about 45% of producers experiencing chronic high stress, I'm talking about that last red part of this bell curve that's showing right now. So 45% of our producers scored in that end stage of stress. So this is obviously extremely concerning. And what we wanted to know was what are those factors that are associated with this chronic high stress? So in order to do that, within our survey, we asked a lot of questions about demographic factors, supports from family, supports from the industry, how people felt about them, how they felt about mental health, and some other demographic information. And what we did was we did a statistical technique of multivariable linear regression to look at which ones of those factors are impacting stress the most for our farmers. And what we found was financial stress was something that significantly impacted chronic stress for farmers, which I'm sure is not something that is super surprising to anyone here. Lack of family support and lack of support from industry. And this was perceived support. So farmers were asked, how supported do you feel by your family? How supported do you feel by your industry? So a perceived lack of those supports led to significant increases in stress. And then farming pigs was associated with significantly higher stress. And within these models, it's probably a good idea to note that these factors are associations that are above and beyond all the other factors that were taken into account in the model. So above and beyond financial stress, above and beyond perceived supports, age, gender, something about farming pigs increased stress significantly for farmers. Resilience, which was scored using the Connor-Davidson resilience scale. When resilience was higher, chronic stress was significantly lower. And then there was an interaction between anxiety, depression, and how high someone's stress was. So you can imagine how this might impact a farmer's overall mental health. And then there's burnout. So we measured burnout in our survey using Maslach's burnout inventory. And this had 3 subscales, which were professional efficacy, emotional exhaustion, and cynicism. Professional efficacy is an individual's expectations for continued effectiveness at their work. So you would like that score to be high. Emotional exhaustion, depletion of your emotional energy, you want that score to be low. And cynicism, or indifference to distant attitude towards your work, you want that score to be low. So scoring high on the 2 components of cynicism and emotional exhaustion, and scoring low on professional efficacy can impact your well-being, productivity, and farm production. Burnout's also been shown to have a big impact on job retention in other occupations. And we would hypothesize that this would also be true for retaining farmers to continue to farm. So in our survey, 44% of farmers were classified as experiencing some amount of burnout. And the way that we measured this was using the latent burnout profile approach. So here you can see along this sliding scale, a farmer could be engaged and then move into ineffective, overextended, disengaged, and fully burnt out. So experiencing any of these things is detrimental to mental health. But in our survey population, like I said, 44% were classified in the ineffective, overextended, or disengaged profiles. And 12% were classified in the burnout profile. So here we wanted to know what the factors were that impacted burnout as well. So using that same approach of multivariable modeling, we looked at those same factors. So age, gender, financial stress, perceived supports, previous mental illness, marital status, and overall health and physical and mental health to see what it was that impacted burnout the most. And here we had different factors that were associated with burnout. Some overlapped, like financial stress. Other factors that were related to burnout included poor self-rated overall physical health, experiencing a previous mental illness, and dissatisfaction with supports from a partner or spouse, from friends, and again, dissatisfaction with supports from the industry. Being single compared to being in a relationship or married was associated with burnout among our farmers. And an interaction between age and gender was also found to be associated with burnout. So what that meant was whether or not you were burnt out based on your age also depended on your gender, with women on the farm experiencing more burnout than men. So with knowing all these factors and the way stress impacts farmers, I'm going to switch it over and hand it over to Heather. And she's going to dive a little bit more into that with her amazing study.
Wonderful. Thank you so much, Briana. Thanks for that nice lineup. And you're going to be controlling my slides just so everyone knows it's not a nervous tick when I say next slide. So yeah, I'm Heather, Executive Director at Farm Management Canada. And really we're about increasing awareness, appreciation, and adoption of business management practices. And so with that, the idea for looking at mental health in terms of the managing the farm business, or the business side of farming, I should say. It kind of all started when we started looking at the work that Briana and the standing committee were doing, and Andrea as well, and looking at, okay, so we're starting to understand that, farmers are more stressed, and, here's some of the things that they're stressed about, and some of those other kind of conditions around, or context around stress. And so we wanted to do a little bit of a deeper dive. And it actually happened. I was sitting at a conference, and I was listening to a speaker called .com. And so he's Mr., here's how to not be so stressed. And so as he's going through some of the symptoms of and impacts of stress, I started thinking about, well, wait a second, I think there might be a connection to all the wonderful things that we promote in farm business management practices. So he was talking about, when you're stressed, it's difficult to make decisions, it's difficult to prioritize, it harms interpersonal relations, and that can make, working with your team difficult. And we thought, well, wait a second, on our side of things, not thinking about mental health specifically, but, we're promoting having a business plan and having a transition plan to take the guesswork out of farming, and to build that foundation or roadmap to, the path going forward for yourself and for the other generations and other people on the farm. So be out thinking, I wonder what the connection between mental health and farm business management is, in terms of, what kind of helps and hinders one or the other. And so that's kind of where our study started. So I guess taking it a bit of a deeper dive with specifically kind of a farm business management lens, and a focus on stress and anxiety, because that was one of the things that we came across too, that, mental health is many, many, many things, as well as mental illness. And so we wanted to focus on stress and anxiety as something that, the industry and other research identified as a significant problem in agriculture. So Briana, next slide, please. So in terms of stress in the Canadian farming population, so our research indicated that about 3 out of every 4 farmers rated themselves as moderately to highly stressed by these factors specifically. So you can see the different factors we tested on the bottom, taken from the work of the Standing Committee and Andrea and Briana, but also from our work in farm business management. So and kind of testing some hypotheses we heard anecdotally as well over the last number of years we've been working in the space of farm business management. So unpredictability of the ag sector and a feeling of loss of control was I guess the most stressful factor to farmers, followed by workload pressures and lack of time, followed by financial pressures. And of course, we talked about interpersonal conflicts with family, farm transition, use of social health services and things like that. But it was really around that feeling of, the world is crashing down on me, and I'm not really sure where I'm going to land in all of this. So this loss of control, and there's way too much going on, and I'm feeling like I can't control anything around me. Next slide. And so we did, I don't talk about methodology too much, but we did do a national survey in partnership with FCC. And I think we had around 1,735 responses, which is awesome. But we also did focus groups across the country, as well as one-on-one interviews. And I like to pull kind of the words from the farmers' mouths in the work that we do. And I just thought this was kind of dead on when we're talking about how, if you were to ask the farmer, how stressful is farming? And so this farmer in Western Canada told us, if I've been working on my crop all season and then a freak hailstorm wipes it out, it's traumatic. It's like PTSD, which of course we know can be absolutely devastating for someone experiencing that. And our farmers are experiencing it all the time, as the data shows. They're living with this. So, let's better understand it and figure out how we can do better. Next slide, please. So we also looked at some demographic differences between the respondents to the survey and within the focus groups and one-on-one interviews as well. But we found that, much like Briana talked about, women and young farmers were more likely to report higher stress compared to male counterparts or older counterparts. And so they experience the stress of the unpredictability of the ag sector, as well as the workload and things like that. But these farmers specifically experience stress due to farm transition and family conflict, which I think is something we need to look at, because when we understand it or dig into it a little bit more from a female perspective, the females tell us that they kind of feel like it's up to them to keep the family harmony together. It's up to them to make sure that we're going to continue to succeed going forward. We're going to continue to have Christmas dinners together, and everyone's going to get along forever and ever. And so there's this kind of maternal instinct that women tell us, and even if they're not mothers, but it's just that feeling of, we want everyone to get along, and we want a supportive place to work and live. On the young farmer side, it's more about kind of challenges in terms of not being able to kind of see their future on the farm. So we know 8% of Canada's farms have a farm transition plan, which is crazy, crazy low, obviously, because 3 out of 4 farms will change hands over the next 10 years. So there's this kind of disconnect, and the young farmers are saying, okay, like, can we start talking about the future of the farm? Because, I'm going on 30 and I have no idea if there's a place on the farm for me, what that place could be, or what we need to do to make a place. And so there's that uncertainty around the future of the farm and their role within it, which is really stressing them out. And then, of course, we know on the other side, there's a lot of stress around, well, if I'm not farming, what do I do, from the parents' generation? So we've got to work on that one a little bit, and we have some ideas on how to do that. We also looked at coping mechanisms and behaviors, which is my next slide. But we did, thanks, Briana, but we did find that young farmers kind of tended to be a little bit less normalized in their behavior in terms of coping mechanisms. So they would do way more of some things and way less of some things, as opposed to the rest of the population that, was pretty typical and pretty average in terms of looking as not relying on these coping mechanisms, but I suppose it's relying on them because that's how you're coping. And we also found that the growing operations were more likely to be stressed compared to mature operations, or those that are kind of more in a status quo, maintain what they're doing rather than looking for opportunity and expanding and growing in all sorts of ways. So looking at the coping mechanisms, we found that farmers under a great deal of stress tend to do more than usual of the following. And some of these things are very, very good. Crunching numbers, that makes us happy. For sure, I would say that's a positive coping mechanisms, as well as assessing and planning for different outcomes. But then, of course, we see spending more time working, and that can contribute to some difficulties with family, some difficulties with the farm team, as well as Briana talked about, burnout and just not having the mental capacity or the physical capacity to do the work that you need to do. And then on the less than usual side, that's kind of where the behaviors add up, and where we see the farmers that are experiencing significant stress attending less social and family gatherings, not feeling in control of their emotions, not sleeping, not feeling motivated about their work, not seeking help and advice, not making timely and informed decisions, and not seeking information and learning. And some of our other research, which I won't get into today because I don't have time, but we've looked at what are those practices that contribute to farm financial performance. And as it would happen, the number one practice is seeking information, lifelong learning, ongoing skills development. Also on there is having a written business plan, also is seeking help and advice from farm advisors, etc. So we definitely see kind of this opposing correlation between those practices that are going to bring you towards success and those practices that are really dragged down when you're under a great deal of stress. So of course, we want to change that, but we need to be realistic about, what we're looking at right now. And if we could move more folks towards the assessing, planning for different outcomes and crunching numbers, we're hoping that will help alleviate some of the negative coping mechanisms. Next slide, Briana. And so speaking of those kind of the farmers that are following a business plan, for example. So we looked at business planning specifically. We looked at all business practices, but business planning kind of stood out as that one thing that was really differentiating farmers. So farmers with a written business plan tended to do, all of the other business practices more readily than farmers without a business plan. So things like record keeping, adhering to a budget, benchmarking performance, and seeking training, communicating about the future of the farm. So you can kind of see how having this business plan helps contribute to providing some sort of certainty. So when we think back to a few slides ago, and the largest stressors for farmers were the unpredictability of the ag sector, a feeling of loss of control, and workload. We look at business planning as an opportunity to look at, okay, so what are the resources I have at my disposal, and what's the best use of those resources in kind of figuring out where we go from here, and having that foundation or that roadmap laid so that when stress runs high and emotions run high, you've done the hard work when your mind was sound, when you were at a good place for thinking about this stuff. And so having a business plan to refer back to, and business plan, including your budget and including your HR plan and all those wonderful things, you have a reference point to look back at when, stress runs high and decision-making becomes clouded. And so we find, I know I'm kind of jumping around the slide here, but with purpose, because we found that those farmers with a written business plan, 88% of them said it contributed to their peace of mind. So compared to, any other practice on the farm, it was the planning, it was the feeling of being prepared no matter what happens that really contributed to, okay, the number one stressor is unpredictability of the ag sector and feeling of loss of control. And the number one combatant or, the kryptonite would be having a written business plan that is kind of a direct link to that. And we found that farmers who use a written business plan are more likely to adopt more effective coping mechanisms. So instead of, retreating away and not knowing how to, what decision to make, not knowing how to prioritize, being all over the place in terms of emotions, those with a written business plan are going back to the plan. They're crunching the numbers. They're assessing different scenarios. They're kind of crossing this out over here and adding this over here because they have that reference piece to figure out, okay, so when times were good, this is what we plan to do. There's been a change of the situation. So now what can we do? And if you're doing business planning in terms of being prepared for all things with scenario planning and contingency planning, then you have a plan A, plan B, plan C already worked out. And I mean, circumstances might change, but you still have thought ahead about what could happen and what track can we pursue if that happens, rather than being in the moment of stress and burnout and crisis and trying to think clearly, which is not a good place to be. But then, of course, I highlight in red on this slide because our other data shows that 21% of farmers indicate they regularly follow a business plan, which is a very small number, especially if it's, since it's so important to all the other pieces around farm business management, but also mental health. And then 48% indicate they rarely or never do. And then the next slide, we asked, okay, so why don't you follow a written business plan? Like, we've got all the data in the world showing that it's going to help with family harmony and profitability and all these wonderful things. And the farmers told us, well, because I'm succeeding without it. Like, I'm fine, thanks. So we scratch our heads a little bit because we're saying, okay, Briana's research and our research all confirm that farmers are, really struggling when it comes to mental health and not in a good place. But they say they're succeeding. So then we start to think about, okay, well, what does success look like? I mean, does success, and we get this all the time on the business management side, does success just mean the difference between being in the black and being in the red at the end of the year? Or do we start to look at some of those other factors that people use to define success? And we did a recent study on the drivers of adopting business management practices. And the drivers that came up were things like, okay, profitability for sure, that's important, but also family and farm team harmony, reduce stress and anxiety, keeping the business on track, managing risk, et cetera, et cetera. So I think, when we see this, I'm succeeding without it, I really do think that we need to unpack that a little bit and really kind of poke the bear when it comes to what does success look like to you, but also what does success look like to the people that you're working with, and thinking of, especially the different experiences of women and young farmers. What does success look like to them? Because it probably has something to do with family and farm team harmony. It probably has something to do with certainty about their future and their role on the farm. And then, of course, there's other reasons why they're not following a written business plan, lacking the time to dedicate towards it. And that's, we understand that, but there's things that, once you understand the ROI, you kind of start to make time for them, even if it doesn't seem you have a lot of time. And we've got lots of resources and research on that, but we won't get into it today. Believing it requires constant updates. So feeling like, having a business plan would actually contribute to feeling more overwhelmed. So that's a real concern and consideration, not knowing what to include and perceiving it as an overwhelming task. So again, we need to work a little harder to, maybe break it down into bite-sized pieces and to more readily integrate the concept of business planning into the everyday practices on the farm. So next slide, please. So yeah, and I mean, we hear this all the time. Like, I try to keep everything up to date, but as soon as I get busy, it's the first thing I drop. In this case, the farmer's talking about books, but that's what we hear. I did a business plan because I needed to get out of a pinch, but things are good, so I don't need to worry about it anymore. When of course our data says the exact opposite. It says, actually you should keep doing this to kind of keep you on track, to keep you motivated, to keep you going, and to give you a trusty sidekick when stress runs high and decision making becomes clouded. Next slide. So this is what I was speaking about before, but in numbers. So you can see the business management activity on the left-hand side. And then there's, regularly following a business plan versus not really following a business plan, and the difference in adoption of practices. We have a similar slide that I haven't included here that compares working with a business advisor to not working with a business advisor, where the differences are even more stark. But here you could see, adhering to a budget, pretty important for farming and agriculture, but without a written business plan, it's practiced by less than half of the farmers. And then as well, seeking training and knowledge is a huge contributor to farm success. And yet, a lot of farmers aren't doing it unless they're encouraged by their written business plan, which should and could include a skills development plan for yourself and for your farm team, next generation, all that wonderful stuff. And then this is the one I really like to focus on: openly communicating about the future of the farm with those impacted. And that's where I think, the women that are stressed, and in particular the young farmers that are stressed, that's where that comes into play. So without writing down, doing the exercise, it's not about having the plan, it's about the planning and the process of planning. So without coming together and being able to discuss, okay, well, where do we all see this going? And it's not, mom or dad saying, hey, here's our future and here you go, you better buy into it. But really having that facilitated discussion where you can talk about, what do we all want? Like, what do we want in terms of our future? What do we want in terms of our business, in terms of ourselves, in terms of our family? And is there a way to bring all those ideas together and do so through this farm? And what does that look like? So being able to openly communicate about the future, but then actually taking the time to, write it down in a plan is huge. It's a huge opportunity for families to kind of figure out where each other is and get on the same track about it, or at least have something to discuss along the way. Okay, next slide, Briana. And then this is, I mean, this farmer can say it better than me, so I probably should have just read this and said, there's my presentation. But the farmer from Western Canada, as part of our focus group, said, it really helps to know where you want to go. That way, difficult years don't seem so devastating. There's a plan in place to move forward and a vision for the future. And that's exactly what I'm talking about in terms of integrating the family, integrating the farm team, integrating generations. It's about creating that vision for the future and then a path you can navigate towards that. Next slide. So then here, I'm just going to name a few recommendations. So our study actually has 24 recommendations, which is crazy, I know. But a lot of those recommendations actually come out in what Briana is going to talk about next. So I'm not going to go into all of them, but I will go to the next slide because we did see some kind of patterns emerge from our findings. So in terms of, the study was titled Exploring the Connection Between Mental Health and Farm Business Management. So in terms of exploring that connection, we did come away with some guiding principles around keeping that connection alive. So taking a risk management approach was very apparent. I think for years and years, we've been saying, okay, what's the one practice that if farmers did, we would all be better for it and it would help them and it would help the industry. And we're like, business planning, it's the way to go. It's everything. But then realizing that, that's not something that's resonating with farmers right now. And it might resonate down the road, but right now it's more of a risk management mindset. It's more of, here's my here and now, not my there and then. And here's what's right in front of us. And we have to figure out how to do our best with what we have right here, right now. And so going forward, we're going to try to more so use language around risk management because it resonates with farmers in the context of business planning and connects to that idea of peace of mind while supporting positive mental health. And also a team approach. So building support teams involving advisors, but also family and peers can alleviate the pressures of decision making. And we're seeing more and more farmers interested in the idea of getting involved in farm management groups or peer advisory groups on their farm to just kind of have a sounding board that they can, have a trusted group they can spill their guts to, but also learn from each other and the lessons learned along the way. And then lastly, a preparedness approach. So, and this is key, I think that planning ahead doesn't mean predicting the future. Because we get that all the time. We get, I don't have a business plan because I don't even know what I'm doing tomorrow and anything could happen. But planning is really about preparing for whatever might happen in the future. So we probably couldn't have predicted COVID, but we could have said, okay, what happens if our supply chain shuts down? What happens if, there's, social distancing caused by a disease outbreak? There are some things about COVID that we could think of ahead to say, okay, what would we do if? And that's really the key to planning. It's not, it's not having a crystal ball. It's just kind of scratching your head and thinking, what if we couldn't do this? What if we couldn't do this? Or what if this opportunity came available? What if that land over there becomes available? Are we in a position to pivot and just go like heck and seize that opportunity? And this is kind of a key shift in perceptions around farm business planning. So we're hoping that, we can be better at using the right language and kind of meeting the farmer where they are in terms of promoting the planning. And hopefully that will bring about, positive change to mental health in farmers through farm business management. And I think that's all I had to say on that one, Briana. I'll swing it over to you for all your awesome information.
Thanks, Heather. Okay, so, Heather did a great job of summing up what their study looking at stress and farm business management and made the connection back to some of the things that we found in our study, particularly around gender and age and whether or not people are willing to take some of these new approaches and address some of these issues that might be adversely impacting their mental health. And that's where I'm going to go to next. So if you remember back at the beginning, so, 40 minutes ago when we started, I gave that number of about 40% of farmers indicating that they would not be comfortable seeking help for their mental health, even if they've identified that maybe they're struggling. And that's something that is very concerning and something that definitely needs to be addressed moving forward. So I'm going to talk about that for, I think, the remainder of my time. But what we did here was we did more of a deep dive into what was going on there and looked at what the motivations and barriers to that help seeking was. So to do that, we did some semi-structured, in-depth qualitative interviews versus quantitative data that we used to inform this study. And we did that back in 2018. I did those interviews myself, and we tried to do as many as we could in person if people were comfortable. But, given the fact that I was located in Guelph, I wasn't traveling more than about 200 kilometers outside of Guelph to do them. But we had a great response and were able to do many interviews in person. And we used a thematic analysis to look at what those motivations and barriers might be. So I ended up talking to 75 farmers, people who worked in the agricultural industry, like yourselves, veterinarians that worked with farmers, and then some folks from other ag sectors like journalism. There was an even split between men and women. And I did 10 of those interviews over the phone, and 65 ended up being in person. And the results of our study showed that there were some major themes that were associated with either willingness to seek help or an unwillingness to seek help. And those themes included accessibility to the resources, stigma that still exists around mental health, anonymity in seeking support, farm credibility, which I'll explain more fully in a minute, and then recommendations for implementing successful resources that farmers could seek help from. So that first theme of overall accessibility, this accessibility of mental health supports and services was a key theme that influenced help-seeking behaviors among all of our farming participants. So conversations about accessibility encompassed participants' perspectives of how hard it was for farmers to find and use available mental health supports. And largely, participants felt that mental health supports were not accessible to them. People talked about having to chase mental health services for months, with one farmer saying, mental health resources are difficult to find. They're not consistent, especially in rural spots. And when you're in a crisis or you're in a situation that you need help, I can't even imagine. You're not in a mindset to go navigating to try to find that information. Many of our farmers emphasized that it was important to build awareness of mental health supports and of mental health just in general within the larger ag community in Canada. Many farmers expressed the need for normalizing these conversations about mental health and mental health services to encourage people and farmers from a young age to be open, honest, and willing to access help. And they believed that in doing so, it would promote the use of these supports when they were available to them. And then within accessibility, there were 3 sub-themes that I'm going to talk about, with the first one being financial. So financial accessibility of these services was regularly discussed by many farmers as an important barrier to help seeking for their mental health. So even where they had identified a mental health support, they knew it existed, they knew where it was, they described that it takes money, and when a farmer is in financial stress, they don't have the money to pay to go to a psychiatrist or a therapist. And then further, farmers explained that there needed to be a cost-effective way of providing interventions, so they cannot always afford to pay. And another accessibility issue was geography. So farmers were less likely to access mental health supports if they were located outside of rural areas, requiring a lot of travel or time away from the farm. In many of these rural areas, farmers described that it was just a little harder or a big commitment to find local mental health support, and that the further away that your farm gets from civilization, the harder it gets to do it. And one participant explained this time commitment to drive to a mental health service, in this case, would have been to an urban center that was over an hour away, hour and a half each way. And then the next closest urban center would have been another hour and a half each way. And that's really hard. Many farmers also described that it was difficult to justify the decision to take time away from the farm for their mental health when time is of the essence here. Farmers don't often have a lot of time. Those extra hours that it would take for them to seek mental health support were often deemed not feasible and were needed to maintain the farm, with one participant noting, "I don't know how you could convince farmers that they have the time for this or to make time for it." Some farmers mentioned that they would prefer more supports and services that were closer to home, or having service providers meet farmers where they're at or be flexible to deliver those services within the farmer's day-to-day time frame to make sure that farmers can access them. Other practical suggestions for making these mental health services more accessible to farmers included making them part of something that's already happening, such as a conference or a meeting. If farmers were headed in that direction anyways, they'd be more likely to participate. Incorporating more mental health resources into existing healthcare services within rural communities was thought to be another way of improving this accessibility so that farmers would be able to access everything they needed for their physical and mental health in one physical place. And then there was gender accessibility issues. So participants described several gender-specific barriers to help seeking and accessing supports for their mental health. They emphasized that men and women often talked about and experienced mental health in different ways, and then consequently faced different kinds of barriers to help seeking. With one participant saying, "For women farmers, I find mental health different. It's the way that we worry because we're different, the way we worry and think about mental health, things are a lot different." There was also this notion of farmer stoicism. So a lot of the participating farmers talked about how macho stuff is huge in farming, and there were a lot of older farmers, particularly males, that probably wouldn't seek any help because that's the guy thing to do. This stoicism or manner of hiding or bottling mental health struggles, particularly among the male farmers, created huge barriers for help seeking. Male participants were described as having to maintain these traditional farming norms, and both male and female participants explained that male farmers were expected to be tough, stubborn, bullheaded old bastards that maybe do need mental health services, but I don't think that they would accept it. It was really common for participants to describe that women would be more likely to seek formal mental health help compared to men. Participants explained that male farmers would talk to other farming friends about their mental health more readily than if they were calling someone they didn't know, like some strange person on the other end of a phone for mental health help. When describing help seeking from formal services, many female farmers described that if they were experiencing mental illness, they would have gone ahead and called someone. "I don't think that my husband would have done that. I think that that's a guy thing." And while males were described as having a gendered barrier to help seeking in needing to be more self-reliant, they were also described as having more readily available informal peer support than female farmers. For example, one female farmer said, "Men tend to get together as dairy farmers more than the women do because men are more involved in the farming committees and organizations and different aspects. Where I think as wives, we just don't have that communication, that togetherness, and I don't know how we do that to really be together and to openly talk, and most organizations are men in the industry." Gender was described to impact help seeking in another way via the traditional female caregiving role, which Heather kind of touched on in part of her presentation. Both male and female participants described that female farmers had this added pressure to support their family's mental health, and that they were responsible for identifying when anyone on their farm would need to seek help for their mental health. Further, many participants discussed that in order for male farmers to be able to identify mental health services, providers would need to send it out to their wives, or that it wouldn't get to them. So our second theme of stigma, many farmers describe being frustrated with this perceived huge stigma that was attached to mental health in ag and related stoicism of farmers. They talked about how farmers hold things in and often don't want to admit they have a problem or admit that they need help. These participants felt that there was a huge need to break that barrier because there's a lot of people that mental health impacts. Stigma around mental health created barriers for people in terms of reaching out for help, accessing support, and talking about mental health just in general. Most participants commented that farmers would not seek help for their mental health because they don't want anyone to know they were struggling and didn't want to look bad in their family or their community. Others explained that farmers have to be made aware that it's okay to ask for help, and they think that's the biggest problem. However, there were some participants that felt that over time, things were changing in their communities and that there was a little less stigma associated with mental health and that it's not as taboo anymore. Others noted that we're gaining inches here, but there's still miles to go. And changes don't take place in a day or a week, especially when those changes involved eroding old attitudes and depositing new ones. Many participating farmers indicated that it was important to continue having these ongoing conversations to try to make mental illness more normal and to show people that most people are dealing with their own kinds of struggles and stresses and mental health issues. And in turn, farmers felt that these efforts would help to kind of demystify the idea that everyone else around them was doing fine, ultimately reducing that stigma around mental health and helping create environments where more people are confident in talking about their struggles and seeking support. So many of the participating farmers preferred a certain level of anonymity when seeking or accessing mental health supports, whether through counseling services or through helplines that were anonymous or confidential. These participating farmers preferred to be able to talk to someone that they didn't know. Preferences for anonymity were also sometimes influenced by this perceived stigma that we talked about and judgment from others or perceived judgment from others within the agricultural community. With one participating farmer explaining, because if you're going to go and talk about your problems, you don't really want to be talking about it. It's a hard thing because you don't want to be sitting there talking about your problems with people that you're in the same circle with either. They need to have distance. It's a tough thing. It's a really tough thing because you need to have enough distance that you can open up, but not so much distance that they have no clue. So while some of our participants wanted anonymity in seeking supports, other participants expressed distrust or discomfort in opening up to people that they didn't know or that didn't know agriculture. These participants explained that you need someone on the farmer's level that they're not going to be embarrassed to talk to, someone that they trust, someone that they know is going to understand. There was this delicate balance related to preferences for anonymity and seeking support, in that farmers typically wanted to seek help from people and places they were familiar with, trusted, or had agricultural knowledge. One industry rep described, we can direct them to, mental health distress lines and that kind of thing, but that wasn't something that they even felt comfortable with because it's a stranger, right? And they felt more comfortable, just talking to us, the industry rep. So whether participating farmers preferred a peer or the anonymity of a formal mental health support, most agreed that there had to be a level of trust in the support or the service provider themselves for the farmer to accept help or seek help. Oh, and this participant said it, there has to be a level of trust. And that leads to the theme of farm credibility. So a mental health service provider or the service itself, their knowledge around agriculture and the considerations that farmers felt needed to be given in terms of specific challenges that were associated with seeking help for mental health was described by them as farm credibility or farm cred. Farm cred was absolutely fundamental for participants to perceive a mental health service as beneficial to them at all. farmers described this real disconnect between some of the available mental health service providers and the culture of farming. Participants commonly indicated that where there was this apparent lack of knowledge in agriculture itself and the realities of life on the farm, service providers are just completely discredited within the community. With one farmer saying, just having the right people deliver mental health services, because we've been to certain farming kinds of things, and if the person speaking isn't really a farmer and they don't have a good grasp on things, it is just such a turnoff that you're just like, okay, you don't really have a clue. It was important to most participants that a mental health service provider can understand what you've been going through and can relate, because that's the one thing with farming, it is so different than other aspects of life. Farmers also discussed that mental health services or providers that had farm credibility were the ones that made certain to take the lifestyle of farming and into consideration, when they were talking about strategies for their mental health. Mental health services or the providers themselves also had to have this farm cred in order to be accessed or recommended to others by participants. So this was described by some participants as making sure that the mental health service availability was flexible within the farmer's time frame. With one saying, I mean, you look at a dairy farmer, they can't do evening meetings or morning meetings or whatever. So you have to be working around their schedules. Participants also commonly discussed this lack of agricultural knowledge or farm credibility on the part of the provider as the biggest barrier to accessing mental health support. So having this farm cred was discussed as an important element of building trust within the service provider, and that could help farmers open up a little bit, that somebody was familiar with the industry that was talking to them rather than having somebody outside of that industry. So all of those things led to these recommendations for implementing resources in this figure. So here, underlying these farmer identified facilitators for help seeking is that notion of farm credibility. And it was just, I can't emphasize it enough, it was essential. And then each of the green leaves represents a facilitator that needs to be considered through that lens of farm cred in order to effectively address the associated challenges, which are represented in that gray circle surrounding those facilitators. So the facilitators included financial support, gender-specific approaches, ongoing conversations to continue to normalize mental health, awareness of mental health supports, proximity of the services, and integration with existing services. And then the arrows moving out from the facilitators through those challenges indicate how those facilitators can help address or circumvent the challenges to encourage the most help seeking. So what I really want you to take home from all of that information that was reported in that study is that help seeking is dependent on the accessibility, the stigma, anonymity, and the farm credibility. There are gender differences when it comes to help seeking and mental health that need to be considered. And using the framework that I put up in the last slide could be useful in helping develop or adopt services that exist to address these farmer identified barriers to help seeking. So just to kind of ground us in where we're at before we move into the last bit of our presentation, we know that there was this gap in Canadian knowledge around evaluated programming for mental health, or even just statistics around mental health outcomes. We know that farmers have unique experiences with mental health and mental health help seeking that haven't been fully addressed yet. And we know that farmers' voices and farm credibility are imperative for successful mental health programming moving forward. So that's the last bit that we're going to move into in this presentation, is we took all of this information, the results from all those previous studies, and we said, what's next? And the one thing that came through was that there needed to be more mental health literacy for farmers created through a farm lens to be able to reach the most people. So that's what we did. We developed a tailored mental health literacy training to improve knowledge and confidence among our Canadian farmers. So We know that overwhelmingly farmers discuss that importance of developing resources that they can relate to. It needed to be the needs of the rural community, the ag community are going to have overlap, but that farmers are distinct. So how did we create this program, and what is it? So to guide the development of this type of program, we turned to a stakeholder working group that is pictured here at one of our first meetings. This group was made up of farmers across all commodities, veterinarians, government staff, industry reps, mental health professionals, adult education experts, and then the research team and epidemiologist. The group was responsible to help us guide all of our research questions, interpret all of those results that I've just presented here today through that farming lens, and develop the intervention. So at our first meeting where we went over all of these results, we talked about what was necessary and what it should look like. And these are the notes from that meeting. And what we found here was we needed to develop something that was ag specific that addressed mental health literacy. So we needed to look at the content. What did it need to look like? How could it relate to the farm? Who needed to take this type of training? Who needed to improve their knowledge around mental health or their language around mental health? How was it going to be delivered? Who was going to deliver it? Who was going to be involved? So what we came up with was our program, which is called In the Know. And In the Know was developed as a 4-hour in-person small group lecture and discussion-based program. The topic areas that were identified by participants and our group as the most important to learn more about in the context of farming included mental illness versus mental wellness, stress, depression, anxiety, substance use, suicide, and resilience and coping. All of these In the Know sessions needed to be delivered by a mental health professional that had an in-depth knowledge of agriculture. And all of the examples and all of the discussion activities were farm-based. So once this was developed, we took it and piloted it with our group of farmers and people who work with farmers. We took their feedback, which are the feedback's right here. Those are the notes from that pilot session. We went over all the content, the pace, the examples, and making sure that the timing was good. It wasn't too long. And rejigged things a little bit to make sure that everything fit. And then we were ready to evaluate it. So evaluation of In the Know took place in Ontario in 6 sessions. We had just under 100 participants. And what we really wanted to know was if In the Know would lead to improvement in farmers' self-reported knowledge of mental health, confidence in recognizing signs and symptoms of mental health struggles, confidence in speaking to others about their mental health, and confidence in helping others with a mental health struggle across immediate 3-month and 6-month follow-up. So within that pilot, we, like I said, had just under 100 participants that completed all of the questionnaires. We had about 40% males, 56% female, a wide spectrum of education and age, and farmers represented the largest proportion of employment among the participants, about 40%. And then the other participants were people who worked with farmers in their job. So going into the results of this pilot, I'm happy to say that there was statistically significant increases in participants' self-reported general mental health knowledge between before the training and after the training, and that this increase remained significant at 3 months and 6 months post-training. So what we really want to see in these few graphs that I'm going to show you, we want to see those red and brown bars getting bigger, and we want to see the yellow bars getting smaller. So you can see that's what's happening here. And then when looking at the self-assessment of confidence in recognizing signs and symptoms of a mental health struggle in another person, the proportion of participants who were confident or very confident that they were able to recognize these signs and symptoms significantly increased from 29 to 68% between the pre and post in the know training. This increase remains significant at 3 months and 6 months post-training, which means that hopefully this knowledge is retained over time. And the proportion of participants who were confident or very confident that they were confident or very confident decreased slightly from 3 to 6 months, but this difference was not statistically significant. So here on this chart, same thing, we're looking for those red and brown bars to go up and those yellow bars to go down. And here we're looking at the self-assessment of confidence if they were approached in speaking to another person about a mental health struggle or about mental health in general. And this showed that more than half of our participants, almost 54%, indicated that they were comfortable talking about mental health in general before they even took this training. And then this proportion significantly increased still from pre to post training to about 74%, and then increased further at the 3-month and 6-month follow-ups. And there were no statistically significant differences in the reported comfort between all of the follow-ups. So again, this is a really positive side. And we think that this continued to increase because folks who took the training had the tools to be able to talk about mental health and then used those tools to gain even more confidence over time. So here, this figure illustrates the participant's self-reported confidence in helping another person with a mental health struggle. The proportion of participants who reported being confident or very confident significantly improved from approximately 12% before the training to 36% after the training. And this remains significantly increased at 3 and 6 months after the training. When we also included participants who felt moderately confident, this gap got even bigger. So approximately 40% of participants reported feeling moderately or more confident to help others, while 82% reported feeling moderately more confident after training. So just to sum up with what all of that meant was that In the Know, as a mental health literacy training for farmers and people who work with farmers, was shown to significantly increase participants' knowledge around mental health, their confidence in recognizing mental health struggles, their confidence in speaking about mental health with others, and their confidence in helping someone who might be struggling with mental health, which is a really exciting thing moving forward. The other thing I wanted to mention is that when asked in the demographic survey, 100% of our participants indicated that they would recommend In the Know to other farmers and other people who work with farmers, which we considered a proxy for that farm credibility. So this was another really important finding. So with that, I'm going to pass it over to Thea, who I think should be here, to talk a little bit more about providing mental health supports to farmers.
Thank you, Briana. Can everyone hear me?
You bet.
Perfect. Thank you. Well, good morning, everyone. Thank you so much for inviting us to speak today at this event. I'm coming to you from Keystone Agricultural Producers of Manitoba, and we are the general farm advocacy group for Manitoba farmers. Our membership consists of over 4,000 farmers and over 20 different commodity groups that we work with to help to ensure the success of farmers. Our bread and butter is definitely our work in the area of policy, and that's where you might be the most familiar with us in the past. But we also maintain and run programs that help with farmer success, including our farm safety program, environmental farm plan program, Manitoba Young Farmer program, and the human resources program. And so I'm going to talk to you today about CAP's response to the research that's been going on and recommendations in terms of farmers' mental health and what they need to be supported with and the information they need to be successful. We've been having ongoing conversations with our farming members about mental health with the goal of decreasing the stigma and normalizing mental health conversations. We're very fortunate because our president, Bill Campbell, who is a beef farmer around Minto, Manitoba, talks about mental health on a regular basis as he communicates both with our members and with the general public. And I think that that's been hugely important to have him as a real champion for mental health and initiate some of those conversations and provide direction to our organization. We're working on regularly sharing information about mental health and wellness with our farming members, and we do so in numerous ways. We've done it in Cap Alert, which is our weekly e-newsletter that everyone's welcome to get in on if you'd like to join up and get farming news. Farmer's Voice, which is our quarterly magazine that's sent to all of our members directly in their homes, and social media. Next slide, please. Thank you. Some of the things we've done in the past year include we've hosted a series of webinars on mental health over the summer months. One of them was on resilience during a pandemic. We had one on burnout and cultivating your way to burnout. We had one on planning for emergencies, fatigue awareness and management, and recognizing and responding to risk of suicide. And these were some of our best attended webinars. We had many webinars throughout the summer months as we couldn't get together in person with our farming members. And the ones on mental health had huge uptake. We knew that this was of interest to them. And when we polled them afterwards about the feedback about these, many indicated that they would like to continue to receive additional information about mental health and really preferred it in that virtual environment whenever possible. And I would like to invite everyone, all of those videos have been recorded and they're available on our YouTube channel. So you can check us out at cap.ca. At the bottom, there are links to all of our social media channels and our YouTube channel where you can watch all of the videos that we've created if they're of interest to you. Next slide, please. Thank you. Our next step moving forward is we're going to offer mental health literacy training to 500 or more farmers next year, starting in early 2021. We're going to be using In the Know, and we're absolutely thrilled about this, bringing it to Manitoba and being able to offer a short, condensed, researched, evaluated form of mental health literacy training to farmers and people who work directly with farmers. This is your invitation to get involved. If you would like to register, we'll be putting registration information up very soon. We haven't announced everything yet, but there'll be 35 virtual sessions offered throughout January, February, and March. This is our pilot of In the Know here in Manitoba, and we're really looking to create an informed and caring network of individuals that can help support the agriculture community and growing that over time. If you're interested, as I said, registration information will be available before Christmas. We're just working to get that out. And we wanted it to be as inclusive and as accessible as possible. So we will be doing it in small group settings to keep it nice and small and ensure that we can meet everyone's needs and answer all the questions on there. We'll be offering some sessions in the morning, some in the afternoon, and some in the evening to ensure that farmers with different schedules will be able to jump on and join us for that. It will be about 4 hours in total, and we're really looking forward to rolling this out and offering this to Manitoba farmers and people who work with farmers. Next slide, please. I just wanted to leave you with some tools and resources as you're working with farmers, or perhaps you're farmers yourself, or even for your own benefit. Just wanted to let you know what is available here in Manitoba. There's lots of different resources out there, but we'll just highlight a few. One of the main ones that we often recommend, and we work closely with this organization, is the Manitoba Farm, Rural, and Northern Support Services. This is a 24-hour-a-day, 7 days a week hotline that anyone from farm, rural, or northern communities can use to call in and get crises counseling at any point in time. It's really important to point out that this service is free. So some of the barriers that were mentioned in the research about cost and proximity, it helps to address those because everyone can call in. So it's free, it's confidential, it's non-judgmental, it's empathetic, and it's solution focused. So they're going to try their very best to work with you to find solutions to whatever you're struggling with. This could be how to navigate the mental health care system, because as we've heard, that can be difficult, especially when you're in crises or struggling with something and don't have the energy to be able to navigate the mental health care system on your own. I would encourage everyone to call this line if you're struggling yourself, if someone you know is struggling, or if you're worried about someone. They offer many different services, including even call-out services. If you are concerned about someone who is at risk of suicide, you can call this line, let them know about the person you're concerned about, and they will do a call out to that person to find out how that person is doing and determine if there is a risk there at all. They've got wonderful services. Give them a call and see what they're all about. Next slide, please. Finally, I just wanted to leave you with an awareness of the other supports that are available within Manitoba. There's mental health first aid training that you can access through organizations like St. John's Ambulance and Canadian Mental Health Association of Manitoba. So you can get training in that area. Mental health first aid training is a full 2-day training. So for many farmers, it might be a little bit too much time off the farm. But for some of us, we can invest those 2 days into becoming trained and be able to respond to mental health needs as they arise. Do More Ag is a great organization out of Saskatchewan that's really focused on mental health across the prairie provinces and moving further. They've got great mental health presentations for you and your community, and they have a mental health fund that you can apply for to be able to get funding to have events for mental health within your community. We know that there's lots of Canadian Mental Health Association branches in rural areas across Manitoba, so you can reach out to them to see what kind of services they offer. The regional health authorities often have mental health professionals working within those regional health authorities. So if you live rurally, you could check that out. And of course, for many of us, the very first place we go is to see our doctor and let them know about anything we're struggling with. And they can also help with guiding us. There's also private mental health care professionals that are available. We did note that cost was an issue, as well as proximity was an issue with accessing some of the private mental health care professionals. I just wanted to point out that during the pandemic, a lot of these have been offered virtually or remotely, making them more accessible. And I think a lot of mental health care professionals will continue to use some virtual delivery of their services going forward. So that's great news for farmers. I also wanted to let you know that there's several organizations that offer sliding scale. So it's kind of a matched up with your income or how much money you're able to pay. So you can pay less if you have lower income or if your ability to pay isn't there. Next slide, please. I think that's my last slide, but we'll just find out. It is. Thank you very much from CAP. I'm going to turn it back over to Dr. Briana Hagen.
Thanks so much, Thea. So I'm just going to do just a really quick wrap up of where we want to leave things as we close our presentation today. So a few recommendations that are coming from myself, Thea, and Heather. We want to recommend that we continue to raise awareness and build research capacity for farmer mental health. We are working really hard and making great progress, but we do have a long way to go here still. We want to be able to support the improvement of mental health literacy for farmers and those who support farmers like yourselves. We want to be able to deliver business management advice, tools and training that focus on risk management and preparedness as a means of facing uncertainty, and to continue to advocate for farmer-specific mental health support services. In terms of supporting mental health literacy for farmers and those who support farmers, as agronomists, what can you do? You can participate and in the No training. If you have even more time to invest, you can get certified in mental health first aid. Advocate for agricultural advisors and others who have regular contact with farmers to take a mental health literacy training like in the No. In Manitoba, CAP is doing an amazing thing, committing to training 500 farmers and people who work with farmers in 2021. Get involved in that, promote it, talk to your colleagues about it. The industry would benefit from it. And, it's just one more tool in your tool belt to be able to have safe and comfortable conversations around mental health. So just to kind of wrap up, if you do invest the time to increase your mental health literacy, take a training like In the Know, you're not going to make things worse by talking to someone or asking them about their mental health. And I just really want to leave you with that. Take the training, increase your awareness, increase your literacy. You won't regret it. It's going to be something that really serves you moving forward. With that, I just want to thank you all for being here today and for your attention. And I'm thanking you on behalf of myself and also Heather and Thea, and we would be happy to take any questions that you guys might have for us. So I will turn it back over to the moderator, and I hope you all have a wonderful holiday season.
Okay, thank you very much, Briana, Heather, and Thea. That was an excellent presentation. And I'm glad you framed it in terms of it being the agronomist role. That's the theme of our conference. And we do forget that as agronomists, it's and looking at the health of the farm, it's the whole health, and certainly the mental health aspect is a big part of that. So again, thank you very much for an excellent presentation, and hopefully people will be able to go back and look at some information and gain some valuable contacts.